Thank you, Mr. Chairman. I agree with my colleagues here today that we need to find a bipartisan solution to the Medicare sustainable growth rate, and that we need to promote certainty and stability for Medicare providers and patients. I want to speak about the efforts within this bill to promote efficiency and quality outcomes. We have a saying in Washington State that we like to innovate, and I know we're here today to legislate, but I need to make sure that innovation is preserved. The Everett Clinic launched a quality outcome program with Boeing employees recently that called for the intensive outpatient care with 230 employees. They coordinated the wellness for these employees that resulted in a 20% savings in health care due to fewer hospitalizations, emergency room visits, and over the last 2.5 years developed medical homes that focused on 750 employees with complex health care issues. All of this coordination between the patient and providers and all of these programs, including the family resources, the Boeing company said was a return on investment not only of quality care and outcomes, but better performance by the employees and their productivity. So this is what happens when we focus on quality outcomes. Providers in Washington State like Group Health Cooperative, the Everett Clinic, and many others are providing efficient, high-quality care, and we've been doing so for decades. Under the Medicare fee-for-service system, they were actually penalized for this. In fact, the Dartmouth Atlas of Healthcare estimated that Washington State providers were paid on average $1,200 less than the national average, and approximately 34 states having a higher per individual Medicare cost. That's why I championed the value-based modifier that we passed in the health care bill. Just last week, Swedish Hospital, which employs over 1,000 physicians in hospitals and clinics in my state, announced that it would be switching to an outcome-based model that would have 25% of its physicians paid directly, determined by patient outcomes instead of fee-for-service. As the Swedish medical director said, quote, "The structure of payment drives the structure of healthcare system, and it determines the way we deliver care." At this hearing, at a previous hearing, CMS Administrator Don Borwick called the value-based modifier a large piece of the component of reducing Medicare costs. So strong outcomes in an outcome-based system will promote savings through the entire Medicare system. This bill sunsets the value-based modifier and creates a value-based program for performance, consolidating many of the incentive programs that were previously in existence. I have expressed my concerns on making sure that the alternative payment model that my colleague just referred to, the previous colleague, is also fully included in an incentive program, because so much of the major investments and reaping of cost savings are happening in alternative payment models. We need to make sure that we're not only getting off of fee-for-service, but moving towards alternative payment models that are going to give us our biggest incentives and savings. That's why I worked closely with Karen Fisher, David Schwartz, Deputy Staff Director Matt Campbell, and others to make sure that we had a full understanding of these goals and amendments that were offered in this legislation. So my main objective is to make sure that our providers stay ahead of the curve, because we want to keep moving forward. We don't want to miss the opportunity to keep the leaders and innovators on the forward march, because they are the ones who are delivering the best cost savings to us as the rest of the system catches up. So, Mr. Chairman, thank you for working, your office and your staff for working with us and to improve this legislation.